Dr. Gen Meredith joins us now. Dr. Meredith is Associate Director of the Master of Public Health program at Cornell University. Welcome. It is so nice to see you.
Thank you so much. It's really a pleasure to be here.
Many of us have seen the TV ads that are encouraging New Yorkers to sign up for this online training course. What is it exactly?
Great question. So there's actually two different programs that the state has proposed investing in. The first is a citizen public health training, and that's actually open and live right now. I'll get to that in a second. And then the second is, in fact, investing in the first public health corps, the first in the nation. And this is a real step towards investing in the public health workforce of the future.
Who is the state encouraging to sign up for this and participate in this?
Yeah, so the New York State Citizen Public Health Leader Training, which is active and live right now, this has really been designed to meet anybody where they're at. We are very hopeful that there'll be somebody in every neighborhood, somebody on every street that will take this course, somebody who is already contributing in some ways to the COVID-19 response, somebody maybe that has been helping support food security at schools or in their community, or has been helping with homeless initiatives in their communities. So, there's so many people who have already been doing a little bit related to public health, and this is a way for them to increase their knowledge and increase their awareness about what their role is, to increase their ability to make connections and to understand how they can contribute to action. And really what we're hoping is that individuals who take this Citizen Public Health Leader training have a sense of greater agency, greater ability related to their own health, related to their family's health, and related to supporting health improvement of their networks, of their communities, of their social networks, of their work environments.
Once they get this education, they get this certification, what role do you see them playing?
This is really focused on capacitating individuals to have more of a role in their own environments and in their own communities.
Do you think many of these volunteers will be healthcare professionals or retired healthcare professionals stepping up and seeing that they're in a position to do this?
We don't really know what to expect. I think the Citizen Public Health Leader Training, we've tried to develop this content to be accessible to anyone. It's kind of fun to go through lots of little videos, lots of reading pages that have bright images to just sort of engage learners in building their own knowledge, building their own awareness or excitement, and introducing strategies that any of us could use in our own lives. So maybe there will be retired healthcare professionals, and maybe there'll be active healthcare professionals, and maybe in fact active public health workers might be interested in the Citizen Public Health Leader Training. And we hope that many, many others, people for whom public health has seemed maybe this opaque title or this opaque field, that they will be able to engage in this learning and see that already they probably are quite active in public health activities, and give them ideas about how to be involved in even more.
So tell us a little bit about the online training. Folks that sign up, it's a 16-hour virtual course, and tell us what it involves and what folks are going to be learning.
Yeah. I think it's a lot of fun, if I'm being honest. We again really have tried to make this present information in a way that is very engaging. So what a learner should not expect is to be sitting in front of a screen and having somebody talking at them for 16 hours. Rather, what the learner will see are a series of pages. So there's navigation buttons at the bottom of the page, and you just move through at your own pace. And there will be videos. We try to present videos in somewhere in the order of 3 minutes to 6 minutes at a time. So, quite short videos. Each of those videos have audio transcripts. And so if it is helpful for you to read along while you're watching, that is also provided. Those videos are complemented with pages that have a nice image or a graphic that describe or depict a concept, and then have some text on the side. And each of the 16 hours is broken up into 4 units. Each unit has about 2 hours of engaged learning, meaning about 2 hours of clicking through content. And then that is complemented by you being invited to engage in 2 hours of live lecture. And some of those will actually be live, but if you sign up for the course next week, you're still invited to participate in the live talk that happened this week. So that 16 hours is about 8 hours of self-directed contact time and about 8 hours of invitation to see speakers dive deeper into some of the specific content. I will also note that each of those units that we guesstimate takes learners about 2 hours, those are divided up into modules. And so it's not that you have to be prepared to sit down for 2 hours at a time to do this. You can really sit down for 10 minutes and go through a few pages, go do something else, and come back and engage a little bit more later on that night or tomorrow.
So people can learn at their own pace.
Yes.
And it's free. Enrollment is free. It's open now. What are the deadlines for getting in on this next round of training?
Yeah, the Citizen Public Health Leader training is free to any New Yorker over the age of 18. Sign up is open now. You can choose a date that suits you to start. We start a new learning cohort each week, and we really just encourage you to sign up and give it a try.
So folks can sign up. Can they continue to sign up through the month of May and June? There's no deadline yet, absolute deadline?
No absolute deadline. We hope to keep this open until 100,000 New Yorkers have signed up for and taken this training.
And that's the goal here?
Yes.
And this is a good idea, you think, to prepare us, to prepare our communities, to prepare our neighborhoods, to have someone in a position that's had this training may make a real difference the next time we have a pandemic. And we know the governor repeatedly says it's not going to be a question of if we have another pandemic, but when.
Yeah. I think the real opportunity from this initiative is just the mere fact that knowledge is power. The more that we know about what we can be doing in our lives to support and maintain our own health and the health of people that we care for, family members, those our neighbors, community members, the more agency, the more ability we have to actually follow through on that. And that's really what we've sought to do here. New York State is quite remarkable in the amount of services that are available to New Yorkers to support health and well-being. And what we hope happens as a result of the Citizen Public Health Leader training is that individuals have a little bit more access to that information and that they feel better equipped to use that information to guide their own actions and to support actions of those that they care for.
Dr. Gen Meredith, thank you very much for taking the time to be with us. We appreciate it so much.
Thank you so much.